Initially, as we all remember, we went into lockdown for a period of time, and now we're in a gradual proceeding through different phases of reopening. But however, there's still many public health measures that have remained in place. Firstly, the personal protective ones, such as maintaining a physical distance, frequent hand washing, and now the increased recommendations, mandatory in some cases, of having to wear masks. So I think, and then there's also been some restrictions around, people still being unable to gather in large groups. And so I think overall that that's wearing on people a little bit. What we've noticed in the actual case data is that over the past couple of weeks, in BC overall, the number of daily new cases of COVID have been increasing again. BC overall as a province did very well the first 4 months or so of the pandemic, where we really flattened the curve. But then as the reopening started, and I think people were really mentally fatigued of maintaining these public health measures, people may or may not have become a little bit more lax in terms of the vigilance that they were having. And that's led to, as I mentioned, the increased cases. And so we have to, I think, start getting into another phase of doubling down on our efforts. So all of us, for example, I think feel a certain level of stress and anxiety because we don't know how long this is going to last. It was better for a while. Now it appears to be getting a little bit worse. So that creates increased stress and anxiety for people. On the other end of the spectrum, I think people who have different coping mechanisms. So for example, people who are already in a great deal of pain, I think during the pandemic, it has caused a certain numbers of problems, such as increased substance use, increased mental health concerns, including people getting to the point where they feel suicidal. And it's caused, because people have had to isolate at home, it's created, I think, some unsafe circumstances for people where there's been reports of increased, domestic violence, increased conflict within the home. So people really overall, I think, are struggling. This, inability to get together in large gatherings or have ceremonies. I think that has really impacted us as First Nations people because we typically rely on being connected with one another, and that usually includes being in physical proximity to one another. And so this learning how to be, socially and emotionally connected and spiritually connected while having to maintain physical distance has required some innovation and creativity. And, I think at FNHA, we've tried through the Good Medicine Initiative to highlight some of those communities that have really, found different ways of expressing themselves, and gathering socially and in ceremony and culture and practicing their culture in ways that are unique and creative while maintaining that physical distance.